Now audible? Am I audible? Yes. Okay. Thank you. Okay. Okay. So we are first time we are doing a live streaming on YouTube. So some problem from some technical problem may be there. Okay. As we have promised, we will start with this Materia Medica. And the first drug we have in the first class we have discussed some bit of this our introductory part of Mathematica, how Mathematica came and what is and how to study it and what are the ways to study. Today we will outright start with the drug. We have listed what drugs we will go through. Now this okay. What drugs we have given the syllabus for our next 6 month course, and of course we are going to next 6 month also. We will try and cover the whole of the Allen's keynote in all its aspects. No, reading Materia Medica is for your exams, graduation, for your PG entrance, for your job entrance exams, plus for your clinical understanding and clinical prescription. We will try and cover all these aspects. Okay, the first remedy we will, and of course, our basis will be the Allen's keynote. Okay, so the first remedy we will start today is Actia racemosa. If you have Allen's keynote, open that. Actia racemosa. Okay. So this is the first drug. You can, those who are only interested in the clinical aspect or practicing clinician, you can skip this 10 minutes portion, introductory portion of each of these videos, because in this portion we will be discussing about the uh, parts used or the prover or the class or the common names. Okay, so this is actually the portion for your PG entrance exams and the exams which are held for job in means for jobs. Okay, so this Actia racemosa has got another name, and famous clinical name is simicifuga. In the clinic you will find most of the drug company are giving the name of simicifuga to avoid confusion with the Actia spicata. Actia spicata is a small drug of limited use. In compared to that, Actia racemosa or simicifuga is a bit large drug, or have many clinical use, or at least more clinical use than the Actia spicata. So this Actia racemosa prover was genes, Jeanes. What other drugs he proved? Okay, prover's name. How to remember this prover's name? To remember the prover's name, you need uh, to start with Hahnemann. What the drug was proved by Hahnemann, and gather those drugs at one single heading of Hahnemann. Then go with the provers, band of provers who was associated with the Hahnemann. Okay, then some common provers like herring, like bridge, like genes have proved, at least you will get 5 remedies which was proved by genes. It was this drug was proved by genes and prepared, Jeanes, genes. Okay, other, what are the other drugs prepared proved by genes is benzoic acid, aramtriphyllum, Dolichus, and Lobelia inflata. Benzoic acid, aramtriphyllum, Dolichus, and Lobelia inflata. How you remember these? No? Uh, Yesterday, or means few days back, Zad was telling me. No, Zad, you have attending? You are attending, yes. So Zad was telling me about Dr. Bishwarup Roy Chaudhary. He is more famous with the now he is more famous about the diet and nutrition aspects, and he got lots of followers after pandemic. I attended his lecture about memory, how to memorizing technique. Okay, I attended his lecture maybe 20 years ago when I was in class 8. So one of the thing I remember from that lecture, association. If you associate one information with the another information, it will be easier to remember. Like name of the genes, the prover name. If you are associating this with the other drugs, or the other drugs you are associating with Actia racemosa, it will be easier to remember what are the drugs proved by genes or vice versa. Okay, so like common name, its common name written in Allen's keynote is black cohosh. Okay, so of course the black cohosh name, with the name comes one another name is blue cohosh. Now what is the drug which named as blue cohosh? No, that is I that is colophylum. Yes, blue cohosh. If you can remember black cohosh, you can remember also blue cohosh. No, this is association of other name. Common name is black snake root. You need to write these things on the sideline. Black cohosh, where the black cohosh is written in Allen's keynote, above to that and below to that, write these common names like bug ben. Another famous common name for Actia, bug ben. Of course, with the bug ben, one more name will be coming to your mind is hen ben. No, hen ben. With the bug ben, can anyone tell what is hen ben? Hen ben is common name of which drug? Can anyone tell me? Yes, Alzheimer's. Very good. So this Actia racemosa is bug ben, black cohosh. This black cohosh, blue cohosh is colophylum. Okay. Another name of Actia racemosa is black ben. Hen ben is the name for hyacinthus. Another name is black snake root. Write it down. Black snake root. Where at one place you will be getting these all common name at one place in pharmacy section of the book Success. Okay, pharmacy section or in Materia Medica section, maybe you will be getting all the common names at one place. Try to remember part by part. All at once you cannot remember all at once. If you try to remember all at once, that there will be burden on your memory. Try to make small group and remember. Like another name for this Actia racemosa is European snake. No, sorry, it's another name is black snake root. Black snake root. Black snake root. Write it there in the Allen's keynote where the name black cohosh is given. Only single one name is given. Write it down there only in small letters. So you need not to refer any notes or any other book when you are going for revision. That is rattle. What I've told, black snake root. Black snake root. Okay. So, of course, one more name will be coming to you, European snake root. European snake root. And that is Asaram. That is in Allen's keynote. Asaram. European snake root. Other is rattlesnake root. If you open Trillium pendulum, you will get this there. Rattlesnake root. Okay. So, these are the common name for Actia racemosa. Other clinical name is semicifuga. Okay. The parts used is rhizome or fresh root. Rhizome or that fresh root. Now from there you can go onward. It will be more. I'm not going to that detail. You can make it your means in your Allen's keynote. What other uh, drugs prepared by this rhizome or fresh root? Write it down there only, and it is prepared in class 3. It is prepared. This should be written also on the heading. Genes, the prover. What other drugs proved by genes was benzoic acid, benzoic acid, Arum, and DL. Five drugs: Dolichos, Lobelia, benzoic acid, Arum, and Actia, proved by genes. Genes is a easier name to remember, like genes. Benzoic acid 5-DL. If you can remember, 5 drug: Dolic acid and Lobelia inflata, Arum, Actia racemosa, Actia racemosa. Okay, these total 5 drugs are proved. Now, why we need to remember as a clinician the parts used? Now, it's not that important until and unless you are going for higher studies in pharmacy, or you are going for to work for a pharmaceutical company, or you are going to own or start your own pharmaceutical company. Then that will be important. When Hahnemann was saying in aphorism number 264 about genuineness of medicine, or that you need to the physician need to have genuine medicine and should prepare his own medicine. It was 200 years back, when apothecaries were the leading force and were means the if you remember the means the war between Hahnemann and the pharmacist at that time, and he wrote Asclepius in Balance in 1805. The apothecaries of that time was not willing, or uh, not giving to Hahnemann with the small doses of medicine he was prescribing. So that was the condition at that time. Now we have lots of pharmaceutical companies which are preparing good, reputed medicine, genuine medicine with good reputation. So we need to not, as a clinician, we need not to bother about that part unless and until we are going to specialize in it. Okay, but for the exam purpose, for the entrance exam purpose, all these should be remembered by you. Now, the first line you are getting here about the mental symptoms in actia racemosa. All the mental symptoms are there. Now, in Allen's keynote, the first few lines are usually from the constitution part. Now, if you go through any drug, say if you see that antium crude, you will be seeing that for children and young people inclined to grow fat for extremes of life. Where from these are coming? These are coming from the stages, a section of Herring's Materia Medica, constitutional stages of life. From there, of course, this was not in proving. So you can say this is clinical observation or clinical symptoms. Okay, these first few lines or first one paragraph usually relates with the constitution of the patient, stages of life, like antium crude, better for extremes of life, for children, for old people. Okay, this is not from proving. Of course, this is not from proving. Where this is coming from? This is a clinical symptom, and some medicine we are getting to work in men. Some medicines are getting better in female. Some are working better in children. What is that? That is uh, what Hahnemann is telling in aphorism number 135. You are uh, a medicine is complete when it is proved in all the constitution of different age group, so that it's more preferable age group and constitution are known to you. So it will be easier for a clinician to select uh, a drug for a constitution, or for a life stage. Like pulsatilla is better suited for younger, CPI is better suited for menopausal women. All these are clinical symptoms. All these are from the constitution and life stages. Okay, not proving symptoms. So Allen's has got the mixture of clinical symptoms plus the symptoms of provings. Okay, next part, in Actia, no such this constitution or life stages is given. The first symptom you are getting in acne racemosa is puerperal mania, the mania after giving birth. So this is also a clinical symptom, not a proving symptom. It has been seen that during puerperal mania, this drug is better indicated or suited. Okay, think she is going crazy. So compare syphilinum. Syphilinum here it is mentioned that syphilinum, we think of syphilinum in insanity. Although Hahnemann is telling that mental diseases are of psoric origin, but we know that it is also due to syphilitic predominance in a person, so that the mental disease is originating. Plus, if you are getting the insanity in the family, we are thinking of predominance of syphilitic miasm. So here you are getting a reference of syphilinum. Plus mancinella is a drug where uh, the patient is fear, patient fear is that she will go insane. Okay, Mancinella. Now, Peperomania thinks she is going crazy, tries to injure himself. Uh, that is mental symptoms. Mania following disappearance of neuralgia. So, what is neuralgia? Nerve pain. Any sort of nerve pain is neuralgia. That famous neuralgia for simicifuga or acne racemosa is ciliary neuralgia. Neuralgia of the ciliary muscles, and from there it is extending to temple, extending to vertex, extending to occiput. Okay, so neuralgia, if the neuralgia stops, we have lots of medicines for neuralgia. One medicine I used to discuss is spigelia, no, the trigeminal neuralgia. So neuralgia, here neuralgia is ciliary. Mostly it could be any other neuralgia, a nerve pain. How you will know that this is a nerve pain? Because it is following the track of nerve, no? Following the track of radial nerve, following the track of medial nerve. If you know by your knowledge of anatomy that nerve is following with this, you can say this is a nerve pain. Pain could be bone pain could be muscle pain could be nerve pain. And this is beauty of homeopathic materia medica, that it has studied human being in its all minute details. No, so neuralgia, mania followed by disappearance of neuralgia. Next symptom is sensation as if black cloud had settled all over, no, and enveloped her, so that all is darkness and confusion. This kind of sensation you will be getting in just after post coryza or post chronic post sinusitis. Just sinusitis is going away, and you will get this kind of heaviness, this kind of dullness around the head, and this is a subjective symptom as if the black cloud is enwrapping the whole head. Similar symptom you are getting in Astrias rubens. These symptoms are not important clinically, because we are not getting these symptoms, or even if you are getting these symptoms, it is covered by other drugs with the other indication, and the symptoms will go. But for your exams, you are getting one of these sensation or one of these subjective symptoms to write. Similar symptom is Astrias. If you open Astrias rubens, you will get that hot air surrounds. So right here in this symptom, write Astrias rubens short form, so that you can refer to that. The hot air is surrounding the uh, head. STS, just open STS ripples and refer to that symptom. Referred? Now come back. Illusion of mouse running from under her chair. Very important symptom for MCQ, very important symptom for your exams. Illusion in Viva, these are often asked. That a lady is sitting and suddenly he saw some mouse is running under the chair. It could be mouse, it could be anything running under the chair. Clinically, anything under the chair, if she is saying, you can take it the symptoms of Actria racemosa. Okay, this illusion of mouse running from under her chair, it's not necessary that this should be running under from her chair. It could be running around the room. Okay, two medicines are in bracket, Laccan and Ethusa. Important for MCQ. Three medicines are there for this symptom: lichen, ethusa, and actia. Okay. Now ciliary neuralgia, you are getting aching, sharp, darting, like screwing something in the globes. Globes means these eyeballs, extending to temples, extending to vertex, extending to occiput. Now this temple is the location for that psychosis. Vertex is the location for psychosis. Occiput is location for syphilis. So you see all these three miasms are getting covered with this single symptoms. No, temple is location for psychosis. Vertex is location for psychosis. Sora is forehead mostly, maybe temple. Vertex is mostly psychosis, and occiput is exclusively syphilis, syphilitic symptom. Okay. Orbit, aggravation going upstairs. No, that in iodum, in calcarea carb, you are getting aggravation going ascending the stair, respiration. Okay, difficult respiration. If you open iodum, open iodum. Okay, there you will getting great weakness and loss of breath on going upstairs. Okay, great. Have you opened? Great weakness and loss of breath on going upstairs. Single line. There is in the bracket calcarea. Okay, calcarea. Clear? So these are the symptoms you need to remember for your MCQ in MD exam. Okay. So going upstairs, if it is ciliary neuralgia, it is actia. If it is loss of breath and weakness, it is iodum and calcarea. Okay. Other symptoms are there for upstairs. We are not discussing that. Now it will be prolonged. Now amelioration by lying down. Now heart troubles from reflex symptoms of uterus or ovaries. What do you mean by reflex symptom? Reflex symptom is that problem is not in that location where the symptom is happening. Problem is somewhere else. Due to that problem, it is happening in this location. Okay, the central point of affection of a drug, say for this actia, is uterus and ovaries. All other troubles are due to this disturbance. Like the central point, if this reflex symptom, you will be getting this reflex symptoms in colophylum. Okay, go to colophylum. Colophylum in the last relationship, very last line, and reflex symptoms from uterine irregularities. Okay, from uterine irregularities, reflex symptom. Okay, another symptom you will be getting sympathetic cough. Sympathetic cough in naja. Sympathetic cough in naja, that is due to heart trouble. Sympathetic cough due to heart trouble. That means the heart is affecting. The problem is not in the lungs or respiratory system. The problem is in the heart, and due to that neural connection to that heart, maybe that you see that hoarseness in the left atrium enlargement. Why sometimes left atrium, one of the cause for left atrium enlargement, maybe the valvular disorder, some valvular disorder, the left atrium hypertrophy is there, that is pressing on the laryngeal nerve, recurrent laryngeal nerve, that is supplying the larynx, that is causing hoarseness. So the main problem is not in the larynx or in the pharynx. The problem is in the heart. Though this is the reflex of the heart symptom in the voice. Okay. So this reflex symptom is mentioned in two places in Allen's keynote. One is in colophylum, one here in actia resinosa. Another is mentioned sympathetic curve. Okay, one is mentioned sympathetic curve is mentioned in naja. Okay, other in Borix Materia Medica, lots of reflex symptom you will be getting. One of the reflex symptom, if I remember correctly, is in asculus. The asculus, the all other symptoms are the reflex of the rectal uh, diseases. Okay, so that is all about reflex symptom, okay, of uterus or ovaries. That means reflex symptoms mean the problem is in the ovaries and uterus, and all other symptoms you are getting are actually due to that problem. No. Next, heart section seizes suddenly, impending suffocation, palpitation from least motion, palpitation from least motion. In bracket you are getting digitalis. Now go to gelsemium. You will be getting the symptom, the famous symptom often asked in MCQ in your university exam, that things until and unless she moves about, the heart will cease. Digitalis is exactly opposite. If he seizes, if he moves, the heart action will be stopped. Same thing is here from the least motion, palpitation from the least motion. So right here in small words, gelsemium to compare. Okay, gelsemium. Now the menses. Next symptom is menses. Irregular. Now we are discussing line by line. In the end, we will be telling about the clinical symptoms we are using in practice. Now, menses. Irregular, lots of menstrual symptoms are there in Actia. One of the most important symptom of menses is the hysteria, hysterical. Pain is pain is there. So much pain is there. The patient is fainting from the pain, getting unconscious, getting convulsion, getting hysterical symptoms. For hysterical symptoms during or means unexplained pain, unexplained neuralgia, unexplained mood swing during menses, before menses, after menses, means just in the period between the start and at the end, or just few days after end or few days before start. This period, if you are getting unexplained mood swings, unexplained mental symptom, unexplained historical symptoms, you are likely to get this actia as your clinical indication. Okay. Now menses, lots of menstrual symptoms are there. One of the this irregular exhausting. Exhausting means, exhausting is weakness, so exhausted that cannot able to walk. Two medicines are there in the bracket, alumina and cocculus. One more medicine is carbo animalis. Okay, open carbo animalis, and you will be getting there a line, carbo animalis. After appearance of menses, so weak she can hardly speak. So weak she can hardly speak. Okay. Here also you are getting alumina and cocculus, but not getting that actia racemosa. So write it here, actia racemosa. In carbo animalis, there is symptom after appearance of menses, so weak she can hardly speak. In bracket you are getting alumina and cocculus, right? Actia also. Okay. If you go to alumina, if you go to alumina, you will be getting this symptom there also, that after menses, see relationship के ऊपर वाला line, after menses, exhausted physically and mentally, scarcely able to speak. Here you will be getting carboanimalis, cocculus. Okay. One more medicine is there, open veratrum. These similar symptoms you need to differentiate. Veratrum, open veratrum, veratrum. There you will be getting that dysmenorrhea part. Go to the last page, dysmenorrhea part with vomiting and purging, like in that, is so weak can scarcely stand. 2 days at each menstrual sinus. Again, here you are getting alumina and carboanimalis and cocculus. So three medicines are constant with these symptoms: alumina, Carboanimelis, and Cocculus. Two more medicines we have studied, Veratrum, and of course the Veratrum symptoms we are referring to is in Veratrum. So Veratrum, and one more is Actia racemosa, exhausting menses. Exhausting menses. And Syncona is a medicine for any exhaustion from loss of fluid. So if the patient is complaining that I am uh, means exhausting with the menses or debility from the loss of vital fluid, it could be diarrhea, it could be loss of blood, it could be loss of semen through night pollutions. Okay, so it could be any exhaustive acute disease. So Syncona is working there also. Okay, so Veratrum album. Now come back to Actia. Come back to our symptom Actia. Now, this exhausting alumina cocculus is all the constant throughout the drugs we have referred here. No. Next is delayed or suppressed menstrual emotion from cold, from fever. So these are the causation you can use. These are the causation you can use. So to write the university exam, you need to have some causation also. So for Actia, causations are suppressed emotion, during menses, after childbirth. These are the causation for Actia. Emotional disturbances, these are the causation. For university exam, in Actia racemosa, write causation at a single place. Okay. So causation is important and menstrual symptoms are always asked for this Actia. Okay. This causation is suppressed emotion, emotional disturbance from cold, okay, after giving childbirth, with chorea, hysteria, mania, okay, with chorea, menstruation. I have told you the menstruation with hysterical symptom. Actia is a drug for clinical use. Other drugs are mentioned. One more drug is mentioned is Magmu. Go to Magmu and search this symptom. Magmu. Got it? Magmu. Got it? There you will be getting in the chapter Magmu. Open Magmu. Magmu. Third last para, last line, causing hysteria. Menses causing hysteria. Two more medicines are mentioned here, Actia and Colophylum. Okay, Colophylum I grade after semisifuga for hysteria during menses, especially at the establishment of menses. Okay, if the menarche is there, just this month menses has been started and hysterical symptoms are coming, Colophylum has an upper hand there. Okay, menses were there for long, but out of sudden this young girl is developing the hysterical symptom, hysterical pain, hysterical neuralgia, mood swings, all this. Actia has an upper hand there. Okay, so Colophylum, go to Colophylum. Colophylum, you will be getting, you will be getting chorea, page number 88. Next page, Colophylum, second page, chorea, hysteria, epilepsy at puberty during establishment of menstrual function. Okay, Actia is in the bracket. Clear? Write it down. Magmu. Write down here in the small letters. Magmu is also important. Magmu. Okay. So this hysteria, for this hysterical symptoms during menses, we have gone through three drugs more: Colophylum, Magmu, and Actia. Okay. Now come back to the symptoms. Increase of mental symptoms during menses. No, you are getting colon and semicolon here. So all these symptoms are combined. These are actually 4-5 symptoms written in a single para. How to read this? Menses irregular. Again, menses exhausting. Again, menses delayed or suppressed by mental emotion from cold, from fever. Again, menses with chorea or mania, hysteria or mania. Again, menses, increase of mental symptoms during. Okay, these are the 4 5 symptoms written in a single paragraph. So you need to read like that. All these are the symptoms of menses. So here we have referred to more drugs, Magmute and Colophylum. Colophylum is an upper hand where even there is epilepsy at the this at the commencement of menstruation at puberty. Okay, if epilepsy is there, this colophylum is having the upper hand. Actinism in general, hysterical symptoms during, before, or after menses. Okay, next is spasm. Spasm, hysterical, epileptic. Okay, the neck is stiff, and you know that this is a hysterical symptom. Okay, paralysis of all 4 limbs, and you know this is all of a sudden a hysterical symptom in a hysterical woman. Okay, again reflects from uterine diseases. Spasm reflects from uterine diseases. Spasm was during menses, I have told you. Chorea, aggravation. Chorea is that abnormal movements of the body part or the whole of the body. Okay, aggravation left side. Now this single symptom is very important for clinic also. More often, this severe left inside left sided inframammary pain. Okay, in bracket ustilago is given. I have seen one case where the person was suffering from night pollution and the habit of masturbation. Okay, if you go to acid phos, there, acid phos, go to acid phos. In Allen's keynote, this phosphoric acid. Phosphoric acid. See, with uh, in the last page of phosphoric acid, second para, emissions, frequent, profuse, debilitating, after question, this, and abased and despair of cure. This was, and in bracket, you are getting with irresistible tendency to masturbate. All these plus this irresistible tendency to masturbate. Masturbate. Ustilago is a medicine. In that patient, I found that left sided infra mammary pain. Okay, I utilized that symptom from Allen's keynote and it works. Okay, this was there, night pollution was there, and this infra mammary pain. So, 2 drugs are mentioned in Allen's keynote for this single symptom, infra mammary pain, left sided. Okay, left sided infra mammary pain. Ustilago. Where else Ustilago has been mentioned? In phosphoric acid, where there is irresistible desire to masturbate. Now again, next, this is the character of pain. If you are asked in university exam, the menstrual pain, you will be writing this pain. Ciliary neuralgia, you will be writing this pain. Any other pain, that pain in the bellies of muscles, we will go through that symptom also. That is one of the more important symptoms for clinical, from clinical aspect. Any pain, if you are getting to write upon, you can use this character of the pain. Okay, and it's very important. Some drugs have very important character of pain, like phytolacca. The character of pain in phytolacca is very important. Here, electric shock like pain, there also electric. 2 places in Allen's keynote, shock pain has been mentioned. The keyword, how to identify a drug in your exam, especially in MCQ exam. If you doubt that this symptom is from Allen's keynote, if you're getting electric shock, this electric shock has been mentioned only at 2 places. One is actia, other is phytolacca. And phytolacca is very important for electric like pain. If you open phytolacca, clinically important. Clinically important. That in clinic you will be getting this kind of pain. Very important. One case of sarcoma we got, and this kind of pain was there. We have prescribed on this basis of pain. flying like electric shock. Go to Phytolacca and see the electric shock. Shooting, lancinating, rapidly shifting. You will get lancinating pain or flying pain at other places also, shifting pain at other places also. But electric shocks, okay, this electric like or electric shock, two places in Allen's keynote are there. Leave the nosode part. In nosode part you will get electricitas, magnetis polysambu. Okay, I am not discussing about the nosode part or sarcodes part or impondrilia part of the Allen's keynote. I am talking about the uh, main portion of the Allen's keynote where only at two places this electric shock like pain has been mentioned. One is Phytolacca, other is Actia racemosa. Only at these two places. And if the electric like pain is there mentioned in your exam, in your question, be sure either it is Phytolacca or it is Actia racemosa. Differentiate with other symptoms. Okay, in various part of the body. Sympathetic. Okay, sympathetic means I have discussed before that sympathetic cough of Naja, the symptom is somewhere else and the disease is somewhere else. Sympathetic with ovarian or uterine disease, in uterine region, dart from side to side, pressing or something screwing inside from side to side. Okay, pregnancy. In pregnancy, what is happening? Nausea. Not a popular, not a good remedy for nausea of pregnancy. We have lots of other medicine for nausea of pregnancy. Sleeplessness, false labor-like pain. Okay, hysterical pain may be there. What is the difference between false pain and true labor-like pain? The false pain won't have main differences, won't have rhythm, won't be increasing in nature, will be false na, will be coming and going like electric shock. Okay, false labor pain. Sharp pain across abdomen, abortion at third month. Sabina is one of the medicine. Habitual abortion. What is habitual abortion? Habitual abortion is not mentioned here. The term habitual abortion has been mentioned in colophylum. Okay, if I am if I remember correctly, it is mentioned. Please check this point, huh? Check it out later. Habitual abortion. So habitual abortion is two or more consecutive abortion before the 20 week. Usually the third month of pregnancy or before the 20 weeks. Abortion at the third month mentioned in Sabina, mentioned in sickle cord. Okay, abortion in third month. Okay, that is habitual abortion in third month. Okay, the open Sabina, you will be getting third month abortion. Okay, other medicine third month. This third month particularly, other medicine is sickle cord. Sickle cord. Go and refer to that. Sickle cord. Got it? Now come back. Colophylum. If you are getting habitual abortion, now come back during. Check this point. Huh? Let me check once. Colophylum. If you are getting habitual abortion there, yes, there is mentioned habitual abortion. Habitual abortion. Third para. From uterine debility. Alectris from anemia. This alectris is also habitual abortion from uterine debility. Now, from anemia with profound melancholy is Helonius. The three medicine for habitual abortion: Alectris, Colophylum, Helonius. The term habitual abortion. Now, the third month abortion is here. Third month abortion, Sabina, sickle cord, and Actia. Okay, habitual abortion and third month abortion is clinically the same thing, but for your exam, this is different, indicating different medicines. Clinically, if you are getting this, all these medicines are indicated. If there is uterine debility, think of Colophylum, Alectris. If there is anemia and profound melancholy, think of Helonius. Okay, that abortion in the third month. Okay, Sabina is one of the medicine for that. Okay, habitual abortion or other medicine, clinical medicine, we are getting Thuja, other medicine we are getting Sepia. Okay, for the abortion, this kind of clinically habitual abortion for clinic. During labor, shivers in first stage, convulsions, shivers in first stage. I don't find any medicines where this symptom is there. Shivers in first stage of labor. Convulsion from nervous excitement. This is also from during labor. Rigid os, pain, severe, spasmodic, tedious, aggravation, least noise. All these symptoms are of labor. You may be asked in your university exam the labor symptom of actiasis. Okay. Now this after pain was in groins. Single line symptom, very important for MCQ. After pain was in groins. Okay. The pain after labor occurring in the groin region. Okay. Now open colophylum. Open colophylum, you will be getting after pains. Now, this after pain I used clinically for after menstruation also. If you are getting pain in the groin, this is actia also indicated there. Not only labor, what is happening actually during labor or during menstruation? Labor an extended form of that menstruation. That means for understanding purpose, that menstruation, what menstruation is doing, unconceived that products which are products of uterus, the whole month uh, build up of the uterus is expelled outside and uterus is working by contraction there. Same thing is happening but to the extended form, that uterus is working to expel the product of conception. It could be during after abortion also. The uterus is exhausted and some nerve which are supplying the groins and supplying the uterus is got irritating, is getting irritated, and the pains are there in the groins. Clear? So the same thing is happening after menses, same thing is happening after abortion, same thing is happening after labor. So clinically you can utilize this symptom in menses also, in after pains of abortion also, and after pain of labor also. So this after pain, whenever the after pains are used, specifically indicating the it is specifically indicating the uh, pain after labor or childbirth. Now come to colophylum here. After pains after long exhausting labor, spasmodic across lower abdomen. Now what the symptom I was referring is extended to groin. The line, the word is important for MCQ. Worse in groin, extended to groin. Okay, if it's extended to groin, colophylum. Was in groin, it's actia. For MCQ, it's important. In the shins, extended in the shins, two medicines, carbovage and cocculus. Okay, other medicine we have learned, actia. One more medicine is there with a similar kind of symptom. Open cuprum. Cuprum. Last line. Relationship से ऊपर. After pain, severe distressing in calves and soles. Okay. After pain, severe distressing in calves and soles. In Allen's keynote, if there is any single symptom above the relationship, it's important for MCQ, it's important for exam, and sometimes it's important clinically also. Okay. So this after pain, come back to actia. After pain, worse in groin. So this symptom is important, and where else these symptoms have been mentioned? So we have discussed. Now, when given during last month of pregnancy, shortens liver if symptoms corresponds. So two medicines are there, colophylum and falciparum. Clinically, colophylum works. Okay, I have given to lots of patients colophylum to ease the labor. If you start in the when the uh, at the end of 8th month or the end last 2-3 weeks of pregnancy, if you start on colophylum 30 or 200, it depending upon the susceptibility, I use usually during pregnancy. If I am repeating it, giving it repeatedly, I use 30. If I am giving 1 to 2 doses or weekly, I will be giving 200. Okay, sometime califos in biochemic is also working. Okay, colophylum is a medicine, pulsatile is medicine, actia is medicine. But and for MCQ, Actia, Colophilum, and Pulsatilla. For clinical purpose, all it's needed is Colophilum, which works. Okay, Colophilum. Now, next next page. Excessive muscular soreness. Excessive muscular soreness after dancing, skating, or other violent muscular exertion. Muscular soreness, dancing, skaटिंग, अदर वायलेंट मस्कुलर एक्सर्शन. नीचे देखिए लिखा है स्विंग, टाइप राइटिंग, पियानो प्लेइंग. ओके, that affecting the muscles of the neck, typewriting, that is also muscles of the neck, muscles of the hand. Okay, these are causing the soreness of the muscles. Particularly, the bellies of the muscles are affected. Bellies of the muscles are affected. Okay, very important. Very important. Rheumatic pains in the muscles of the neck, back, feel stiff, lame, spine sensitive from using arms, swing, typewriting, piano playing. Two more medicines are given. That is important only for MCQ. Agaricus and ranunculus bulbulus. You won't need any other medicine for clinical purpose. That bellies of muscles are affected by inhalers occupation, where the occupation is tailor, typewriter, piano players, okay, where the excessive use of the hands and this is are there. Now, those who are baking bread, uh, if you see how they bake the roti, the this means in hotels, how they bake bread, they excessively use this part. No, they are putting this duff on something and putting it in the oven like this. They are constantly doing this motion. Also, it is useful for them also. Okay, so rheumatism affecting the bellies of muscles, pain, stitching, cramping, pain like electric shock, darting. We have discussed the character of pain earlier. Now, for Rustox, the sprain is one-time sprain. No, uh, for chronic sprain, one more medicine we are having strontium card, ankle sprain, knee sprain. Okay, the joint sprain is also Rustex, more for acute, can be used in chronic. Muscle sprain, muscle spasm also can be used Rustex. Arnica mother tincture can be used externally, but the sprain which is due to constant repeated action for years, no, like typewriting is straining the muscles but repeatedly, no, Actia is the medicine. Those who are plowing the field, those who are digging a hole in the field, or doing something which is requiring the muscles of the hand and the neck, a repeated action for years, Actia is one of the medicine. One time sprain, think of Rustom. Repeated action of the same, think of Actia. Okay. Rheumatic dysmenorrhea, only single medicine, single symptom, which is above the relationship. I have told you the symptoms above the relationships are important for MCQ, sometime for clinic also. Okay, above the relationship, and if it is single line, mark it with star. This is gem for your MCQ. So rheumatic dysmenorrhea. What does this mean? Dysmenorrhea, painful menstruation with the affection of with the rheumatism. Okay, so this is called rheumatic dysmenorrhea. So two sphere of action, if you want to see of this drug, sphere of action is uterine, rheumatism, the joints, the muscles, and the mental sphere. That is associated with the menstrual symptoms. Okay. Now relationship. Some relationships are important, and those who are finding difficult to memorize Allen's keynote for their MCQ, try to remember it in parts. Start with modalities in if you go through success, all the modalities have been given at a single place. Okay, so try to remember the modalities. All the relationships are given at a single place. So try to remember the relationship in part by part, and try to remember first few paragraphs of the constitution of the age related description of that drug. Okay, so in this way you can remember part by part Allen's keynote. If you can't remember memorize all of the symptoms, try to remember the single line above the relationship. Okay, this is single line rheumatic dysmenorrhea, only single drug, single symptom which is present here, actia racemosa. Now relationship similar to colophylum and pulsatilla in uterine and rheumatic affections. To agaricus, lilium tick, and sepia. Similar to agaricus, lilium tick, and sepia. No description is given, but similar to colophylum and pulsatilla in uterine and rheumatic affection. Maybe this line is given in MCQ. If I remember correctly, lots of MCQ have been asked with this single line only. This remedy is similar to colophylum and pulsatilla in uterine and rheumatic affection. So drug is Actia racemosa or Simicifuga. Aggravation is given during menstruation. Of course, aggravation is there. All the symptoms are aggravated during menstruation. Okay. More the flow, more the pain. Very important symptom. More the flow, more the pain of Actia racemosa. Very important symptom. Okay. Actia. The more profuse the flow, the greater the suffering. Okay, clinically it is also very important. The more the flow, the greater the suffering. Which suffering? All the suffering with the flow. So like lachesis, with the flow easing all the complaints. So here with more flow, the patient is suffering more. Okay, pain is more, mood swings are more, hysterical symptoms are more. This patient is fainting from the pain. All these symptoms are there. Okay, so trillium is fainting with flooding. Trillium flow is there and faintness is there. Okay, but there fainting may be due to that loss of blood. But the fainting of actia is related with the mental mind, sphere of mind. Okay, so we have completed Actia racemosa as a whole, starting from the common name, provers, and important symptoms, clinical symptoms. Now, in clinic, only two places are used in clinic. Is one is a hysterical symptom during, before, and after menses. More profuse the flow, more the pain. Important, very important. Other symptoms I use is the affections of the bellies of muscles, the constant repetitive actions which is causing the soreness of the muscles. These symptoms is very important. I use it in clinic, and use it in your clinic. You will be getting result. So we will be stopping 1 hour completed. One single medicine. This medicine is very small, and we have taken 1 hours of discussion. That is maybe an exhaustive discussion on any drug I have done. Okay, no, because I haven't taken before any Materia classes. That is why I didn't feel that I didn't know that I will be this much exhaustive with Materia Medica. So I need to take more classes in order to complete all of the drug we have listed. We may increase the classes if we get some time in the week. As of now, we will be having only two classes weekly. Okay, and we will try and complete all the drugs listed in the syllabus. Maybe skipping some pharmacy part, what we have discussed in the initial 10 minutes. Okay, now if you have any question, we can take questions in next 2-3 minutes, and then we will be closing. If you have any question, we can take that in next 2 minutes. Anyone having any questions? Anyone, you can type it here in the chat. You can type in next 2-3 minutes we are taking questions. Okay. Anyone having any question? From next class onward, we will be on teachment. Okay. So, no question. Okay. Thank you. We will be ending our stream. Thank you for joining us.